year, health and wellness have been huge focuses in our lives. In fact, the pandemic has even shifted the way we receive health care. I'm Natasha Lubchenko. Welcome to today's CT Style Express. Joining us to talk about expanding telehealth options is Paul Bartosik, Regional Vice President of Harvard Pilgrim Health Care, a not-for-profit health insurer right here in Connecticut. Hi, Paul. Welcome. Thank you for coming on today.
Natasha, thank you very much for having me. I appreciate it.
Sure. So I know Harvard Pilgrim Health Care was founded over 50 years ago. You've been around for a while now. But how has this past year, how has it changed what you offer to the people you serve?
Well, it's been a very interesting year, as you can imagine, and we have seen an explosion, if you will, in the use of telehealth and telemedicine over the last 12 to 14 months.
Absolutely. And now I know you guys have launched something recently, expanding on the virtual choice. Talk to me about what this is.
Sure. So we did launch back in January a health plan called Simply Virtual, which does allow members to choose a virtual primary care physician. We're always looking for ways to continue to innovate and certainly offer new options for our members and the employers who choose us to offer coverage to their members. So as a result, this September, we're rolling out some more plan options called Virtual Choice. It's really an option where members can choose. They can choose the primary care directly through that virtual offering or choose a brick and mortar and in-person primary care physician.
Great. And what is the value of the flexibility and the choice available in a plan like this?
Well, it's just amazing. It certainly offers members who choose this plan to have 24/7 access to a primary care physician anywhere that they might be throughout the United States.
Okay. And now talk to me about cost, in-person versus virtual. Is there a difference here?
It does tend to be lower cost using the virtual option, as well as certainly the ease of access for any member who's chosen that plan.
Wonderful. And I know back in January you started launching, the telehealth, and this is just an expansion of that. So what have the responses been so far on these offerings?
Well, it's been overwhelming. There's been a lot of interest in the marketplace. Employers and brokers with whom we deal are constantly asking us about the plan options, which is one of the reasons why we decided to really expand what we're offering later this year.
Perfect. And now, who is this plan good for? Talk to me about who can benefit from a plan like this.
It really could be anybody. It's certainly very much a personal decision in terms of comfort level with technology, but as long as you have a camera-enabled device, whether it's a laptop, a smartphone, or any other camera-enabled device, you're able to use this particular plan and select a primary care physician virtually.
All right. And if someone's interested in this plan, how do they go about finding out more?
Well, if you're an employee, talk to your employer, and if you're an employer, talk to your broker. But certainly anybody can also visit harvardpilgrim.org/CT.
All right, Paul, sounds like a great program. Before I let you go, I know you guys are a not-for-profit. You give back to the community. Talk to me about what you guys have been doing lately.
Yeah, it's very important. So obviously all the employees work and live here in Connecticut, and we think giving back to the community is extremely important, especially given the pandemic over the last 12 or more months. We did see food insecurity as a huge issue, so certainly through our foundation have given over $1 million of grants to local nonprofits throughout Connecticut and New England.
Okay, Paul Bartosik, thank you so much. That's great information there. Thanks for coming on today.
Thank you very much, Natasha.
All right. And again, if you guys at home would like to learn more, head to harvardpilgrim.org/CT for CT Style. I'm Natasha Lubchenko. Have a great day.